Hey, good afternoon, everybody. Welcome to really our first AMA, Ask Me Anything in some time. It is an honor to have Dr. James Leonard, Chief Medical Officer for Northwest Health. Obviously, we know the county is in red, and we've had a lot of questions, concerns, and issues. And we thought we'd bring Dr. Leonard. He's very busy, so he has just a short amount of time, but what a great man, great partner. And we're fortunate to have Northwest Health and Dr. Leonard and everybody in the community helping answer those questions related to COVID. So, Dr. Leonard, hey, great to have you here. Sorry it's under these circumstances, but let's get right at it. How is everything? What's the latest at Northwest Health regarding COVID?
Yeah, well, thank you, Mayor. I appreciate the opportunity to be back here and speak to this again. So yeah, the situation is, we're at capacity. Volumes are very high, admission rates are very high. We have moments where we got patients holding in our emergency department. Those are patients that need beds, have a medical condition that requires admission, and they're holding in the ER. We have resources around those folks, proper nurses and doctors to advance and progress their medical care, but it's happening in places that are outside of a typical real bed. ICU is full. About 50% of those patients are up there on ventilators with COVID. The other half are for other medical conditions. This situation that we're having now across the nation, across our state, and more specifically across the northern portion of our state, and we're right in the center of it, is that we have a COVID surge on top of very high volumes of patients being admitted for other unstable medical conditions. That's the difference compared to what this looked like about a year ago. Other folks that didn't have COVID were hunkering down. They weren't seeing their doctors. They weren't going out. They were staying in. So the surge was really dealt with in a much different way. The majority of what was in the hospital was all COVID. So the resources were allocated all around that. Now we have, our COVID cases are about 75–80% numbers that we've had last year on the admission side. But now also all those folks that do need medical care are going out and seeking it out, getting it. They are unstable, and they also have to be admitted. We have to take care of all of the unstable COVID cases, and we have to take care of all the unstable other medical conditions. We have to serve the whole community. So it's a combination of both that's leading to our maximum capacity issue right now. And that holds true for every hospital in our town, in our county, in our state, in the entire region.
So what happens if somebody comes into the hospital now when you're at mass capacity?
They still receive the exact same care. If you have to come into the emergency department, you're going to be greeted as you typically are. You're going to see a triage nurse. If you have an unstable medical condition, that's going to be dealt with immediately. There are processes in place that we have strategies and tactics to get to the people that need it quickest. But you will be seen, you will be cared for. Nobody is turned away. Nobody is triaged to receive care or not receive care. Everybody's getting it. We have a region-wide transfer center that's in place to help, when we identify patients that have to be admitted, if we don't have an immediate bed available or resources available, we're getting into our transfer center who's reaching out to all other hospitals in the region and the state, trying to find placement. And we are accepting cases in. We're part of this as well. A lot of stuff is coming in from far, far away because we happen to have a bed at that moment of the call. There's no patient waiting in the ER for a bed. Bed becomes available. Some hospital from out of state or way down, downstate is asking, and we got the space, so then they come. It's been unprecedented times, and everyone's pulling together to find space and proper resources to take care of all of these patients.
But this just isn't LaPorte, it's Stark, Porter, South Bend. Even though you don't have coverage there, you're hearing about this. It's not just LaPorte.
Absolutely aware of it. It's absolutely a fact. I communicate with other regional chief medical officers. Our CEOs communicate with other leaders of other hospital systems. And there's all kinds of forms of reporting that you can check in and you can just see what the numbers are. When you look at the Indiana State the dashboard on cases and such, you see that we are in an advisory level red right now in our county, as is really truly for the most part, the entire northern portion of the state of Indiana. All those counties are in a level 3 or advisory level red. I got some numbers again. We should go over these things. I'll just kind of catch everybody up. It's been a while. I'll start from the top down like we used to. Total cases to date, and it's going back from late February, March of 2020. Total in the U.S., 50 million. Total cases in Indiana total, 1.2 million. LaPorte total, over 18,000. That's LaPorte County. Total deaths, U.S. total, 880,000. Greater than 880,000 total deaths. In the state of Indiana, over 17,500. And within our own county, 275 patients have died. As far as, I was speaking to our county advisory level. Currently, we have, regarding every 100,000 residents in the county of LaPorte, 500 of those are tested positive on a weekly basis. So that's 500 new cases per week per 100,000 residents. To hit level red, it's 200, and we're at 500. There's another way of measuring prevalence, and that's called the 7-day positivity rate. Of all the people that have come in and get tested within our county, how many of those in the 7 days tested positive? What percent? Right now, we're at 17.5%. To hit the level red, it's 15. So, and that's increasing week over week right now to be at 17.5%. So we are definitely surging. Like I say, when you look at overall cases, we're about 80% of where we were at our peak last year, the all-time high, and then that equates with admissions as well. As far as admissions go, and you look at the types of cases that are being admitted, is anywhere between, roughly it's about 12 to 15% of all the COVID cases being admitted are vaccinated. The remainder, the 85% or so, are all unvaccinated. Of those that are vaccinated being admitted, I haven't seen one that's hit the ICU yet. And those that are being admitted, those are the folks that do have underlying chronic medical conditions that put them at higher risk for severe infection anyway. So those folks are being admitted, but the good news is I'm not seeing them hit the ICU on any speakable terms. So it just goes to show that the vaccines are working, especially against Delta. The Delta variant, we're at about 96% of all cases in the state and in our area are the Delta variant right now. It spreads easier than the original strain, and it's more severe. A piece that we're seeing ever since vaccines have come out, and you look at a redistribution of all the types of patients, ages and comorbid conditions, who's really getting sick the most. It's an incredible rise in the number of folks that are in their 30s to 60 that are being admitted with severe illness. So that's new compared to how things looked this time last year. It was the elderly, with very serious medical conditions that were being admitted. Now we're seeing it in otherwise very healthy young adults, unvaccinated.
Young adults being 30s?
30s. Yep. Several cases where I know of several. I'll be very clear on not talking specifics, but very healthy young folks with no medical conditions are coming in with severe illness. It's a lung-related thing, right? So marked difficulty breathing, they need high volumes of oxygen to keep them saturating properly and surviving, and that requires hospital admission.
So basically, vaccination, if people go out in LaPorte County, I think is at 45%?
That's right.
Only 45% vaccinated, but especially in the young people that don't have any comorbidities, the ones that you're not seeing any vaccinated young people in the ICU struggling. So to me, it seems this isn't political. Get the vaccination, and most likely you're going to stay out of the hospital and stay from dying. Yeah,
I can't stress enough how important it is to get the vaccine. It's been quite a while since they've been out now, and we're getting them, and we do a good look back and see what kind of side effects are occurring, what kind of adverse events are occurring, and then you weigh that against the benefit, which is these reduced admissions and really marked ability to keep most people from having severe illness and requiring hospital admission. So it really is paying off. Everyone has the right to make their own decisions, and you just have to weigh what you think is right for you. Is vaccination right? Or is keeping yourself away from others, especially now with the prevalence so high? If you're concerned about being vaccinated, well, then you should stay away. You should hunker down. You should, keep that 6 feet distance, wear your mask, hygiene, all those things that we've talked about. You have multiple options on trying to keep yourself safe. But I would highly recommend to get vaccinated. That's what's going to do it.
And again, once you have COVID and someone walks in the hospital and they're not vaccinated, it's not like you can give them a vaccine to help. That ship has sailed.
Yeah, then it's too late. Right. There are some treatments that you can provide for folks that are being admitted, but you get vaccinated when you're healthy. And it takes about 2 weeks after your second dose to really confer any meaningful, strong resistance from the virus as far as a proper level of immunity. That's right. As far as other treatments, there's an IV antiretroviral medication, antiviral medicine called remdesivir. That's an IV drug that has been proven to reduce the viral load in people that are severely sick and require admission. Steroids are given to reduce the inflammation in the lungs and in the body to help with the healing process. But those are treatments after you're already sick. There are monoclonal antibodies. This is a treatment that's given to folks that are predominantly at high risk for severe infection. It's approved for those who are sick or for those who have high risk for infection and have had a significant exposure. Both qualify. There is a marked limitation and availability of the monoclonal antibody because the state is just burning it up right now with so many eligible, appropriate folks that need that medication. So we are getting the allocation that we put out for. We're getting what we can from the state. The state releases that. All of our physicians on the primary care side, the ambulatory side, emergency departments, when they identify someone who's eligible for this kind of medication, they're setting them up to get that treatment. As long as the supply is there, the medication is available, they are referred to the infusion center and other areas where they can get treated. That does help reduce severity of illness, again, with the point of trying to keep these folks from being admitted.
But is it fair to say those 30-year-olds, because I have a lot of friends in their 30s, unvaccinated, when they come to the hospital, it's not a joyride. I mean, they're struggling. I don't want to get into HIPAA or anything like that, but it's not a pleasant experience.
No, it's worse now than it was before. Most folks are rolling the dice back before we had vaccinations, and you're young, you're healthy, you're getting out there, you're doing your thing, you're thinking, I'll just take my chances and see if how sick I get. Far majority of folks that are in that age range that are otherwise healthy, they most fare well. 80% do very well. It's the other 20% that don't. And if you can't predict those who don't have risk factors that are going to get severely sick, but they are hitting on a very regular basis into our emergency department and getting admitted now.
So
Game changer.
Joan Berryhill said, the doctor said 100,000 people in LaPorte County. And she said, I'm confused. Do we have that many people living in LaPorte County? We actually have 120,000 people living in the county.
Yeah.
So that number was accurate, 100,000 people.
Yeah, and I'll clarify. There's a standard measure when you're looking at prevalence. You want to have a standard way of measuring it, regardless of the county or what your population is. It's meant to say, it's like a ratio. For every 100,000 residents you may have, this is the number that are sick. So if you were in a county that had a total of, say, 50,000 total residents, and your numbers, your positivity, your total count was a specific number, you'd do the math, do the ratio, and then you'd report out in an as per 100,000 kind of a way of reporting. So this is just a standard way of clarifying what that looks like. It's measured, every county can measure the same way and report the same way, and helps you to compare against counties and as to where you're at, and then you can also watch, kind of like a surveillance mode to see like what's coming. Our surrounding counties getting higher and higher, and it's approaching your own county.
How is staffing at the hospital? I mean, I guess we first should say thank you to all the staff, doctors like yourself, that are just being pushed beyond normalcy and to the limits. Thank you to the entire staff that are keeping everybody healthy. How is everybody holding up?
Yeah. Got to just echo what you said. We have such an incredible team. And so they're just sticking it out after all this time. We're almost 2 years into this and dealing with it ourselves. And the team is there. They're sticking it out. They're working extra shifts. They're working beyond their shifts, longer shifts, just whatever it takes to continue to take care of these patients. It's a true calling. But you can't ignore the reality of burnout. It's coming. It's there. We want to support all of our staff, whether that's a nurse, a respiratory tech, a physician, a mid-level provider like a physician assistant, nurse practitioners, our certified registered nurse anesthetists, on and on and on. The list goes on. I don't mean to exclude anybody here. Everybody is triple timing to get it done. So staffing is there where all the beds, all the units are properly staffed. It's just that now with surges, you've got, it's additional cases that are in the hospital, more cases that need admission than you've got beds for at times. There's capacity management strategies and tactics that we have that we enable to open up more space and bring in more resources so that every patient gets properly cared for timely. But that is, it's getting harder and harder to make that happen every day. And if it wasn't for our staff that's stepping up and coming in, picking up extra, adding on to the standard staffing models that we have, we wouldn't be able to do it. And again, and this is happening everywhere. So hats off to not only all those folks within our own system, but our neighboring hospitals and all that they're doing. Everyone's in this together.
That's fantastic, and thank you again to all the professional staff and everybody across the hospital, medical providers for doing what they do. Rich Poynton says, if you're fully vaccinated, get a mild dose of COVID, how long do you think you have to wait before you get the booster?
You want to be symptom-free. If you've had some mild symptoms, they say, it's at least about 10 to 14 days after your symptoms are completely resolved before you want to go back and get a booster. You want to consider yourself, you're feeling healthy, you're healthy, and you're at least 10 to 14 days off from a positive test or when you believe your symptoms resolved.
Tricia Stahl says, outside of the vaccination, what else would the doctor recommend for people to do to boost immunity? Is there D3, zinc, and every person is different, I know, but are there things you'd recommend for people to try?
Just all the things that you personally know and you trust to keep yourself healthy. Multivitamins, vitamin C, the zinc, there's no harm to all of these other medications and over-the-counter things and homeopathic remedies and such. Whatever you think is safe, it is okay to use. We went through a phase where there were some treatments for COVID. They were very controversial, and studies have been done front to back on these medications like hydroxyurea and all kinds of different things, and those hydroxychloroquine, these things were not working. Leave the treatment to COVID to the professionals on that end, but as far as boosting your immunity and keeping yourself healthy, get good sleep, eat right, exercise, and take those supplements and those things that you personally believe are safe for you.
Also, is it a good idea to get a booster that's different from your original vaccination, or does that not matter?
Yeah, that's acceptable. There was a phase where, depending on where you were at, the state was allocating a certain type of vaccine to certain areas, and sometimes that was not matching up. It is accepted by the FDA, and it's been proven to be effective that you can mix and match vaccinations in series for the primary series, which is your first and second. If it's Pfizer and Moderna, you do two, if you remember that. I'm sure most folks understand this. Pfizer, your first dose, it's followed at 3 weeks later. Optimally, 3 to 4 weeks is going to be your second dose, and Moderna is approximately 4 weeks later, you get your second dose of Moderna. Johnson & Johnson, or the Janssen vaccine, that's the single dose. All three of those come with boosters. When it comes to Pfizer and Moderna, the booster is 6 months after you receive your primary series. So your first two doses, wait at least 6 months, make sure you're healthy, then you get your booster. On the Johnson & Johnson, it's 2 months after you receive that first dose, you would go in and get your second booster dose. But they can be mix and match. All three of them are interchangeable.
So Candy Porter wants to know, do you recommend mask mandates and restrictions since we have high number of unvaccinated people? And one thing we've been doing, and I've offered Candy to come volunteer and help, is go into, especially these lower income apartments, go door to door. We're actually bringing vaccines. This isn't for just, Facebook to complain about the mayor doing this or that. We're actually going into low income areas and providing vaccinations. And I think better than telling people don't have these people go to events, those individuals, if they're should not go to public events, or they should go out and get vaccinated, it sounds like, or stay home.
Yeah, if you really want to be out and getting back into life and getting into mass population events, do it, but get vaccinated. That way you're going to be safe. If you're not going to get vaccinated, okay, but just understand you're putting yourself at a much higher risk if you're going to get back out there and expose yourself. I would separate out the science from the politics on mandates, but masking works and distancing works and vaccines work. That's what I recommend doing.
And so people, again, there's no mask mandate. The health department, who've been amazing in partnering us, the long-term effect of, hey, get the vaccine. That's number one. But you obviously recommend masking, especially for those unvaccinated or staying home, staying out from the public. And so there won't be a mask mandate. But again, let's make sure we're out getting people for the long term, because this isn't going away. People need to be vaccinated, correct?
That's right. It's going to do the most amount of good. And again, back to our advisory level, currently our prevalence is extremely high in our county and our surrounding counties. So it's out there and it's everywhere out there right now. So it just makes most sense to personally choose to put the mask on and expect and try to, encourage your neighbor, the person in the store next to you, to do the same thing. The prevalence is very high. It's there right now. I understand you go into certain areas, certain times of the year, and you don't see anybody wearing any masks. And you wonder, well, what's our prevalence? Is it really out there? Am I okay? I'm vaccinated. That's understandable. But now our again, prevalence is very high. Many folks are out there that are sick or they're asymptomatic and carrying it. So now's the time to put the mask back on. But again, vaccines are the number one way that we're going to get through this.
So Sherry Stahl would like to know, and I guess it just brings up the age of vaccination, can a 6-year-old get vaccinated at the old hospital?
Yes, they can. They are providing, the Pfizer, as I understand, is being provided at the hospital through the community service, as is the Moderna. Pfizer is the one that's approved for 5 years and older. And so, yes, anybody 5 years and older can be vaccinated there.
Is there any plan, and again, I think you've stated this, is there any plan in prescribing medications like monoclonal antibodies when people test positive to try to keep them out of the hospital?
Yeah. Monoclonal antibodies are a very good option to try to reduce the severity of your illness once you've been sick. But the problem with that is that it's at a premium. It's tough to get your hands on it. They're producing it at a rate that the state is getting it out to everyone that's asking for it as fast as they can. But currently there are way more people that could benefit from it that just can't get to it because there's not enough of it out there. But still, I encourage you, if you have symptoms, do a telemedicine version of getting with your doctor. Talk about your symptoms that you're having. Get tested. If you're positive and you meet the criteria to get the monoclonal antibodies, I would recommend it. Your doctor will try to line that up for you. There's a process to get that done that the physicians know how to do that. And if it's available, you'll get it. And allocations are coming in week over week. It's always coming. So don't not try to get your hands on it if you need it. And your doctor will help you determine if that's necessary.
This isn't really for you, but when are you going to stop myself promoting super spreader events and acknowledge what dangerous situation we're in? And again, we ask a lot of people, volunteers, to help that don't come out, help make it better. We're working every day. We just don't promote it. And it's a balance. It's a balance on lifestyle we've chosen and a balance of staying healthy. I know Sue watches whenever I have my mask and whenever I don't. But we're going to continue to try to balance and encourage everybody for the long haul to be vaccinated, going door to door, and try our best. But at some point, because this isn't going away, there's also a lifestyle, and those that are not vaccinated should really choose to stay home. Stay out of, we talk about groceries, and there's a question here. There's plenty of delivery opportunities to have your food, deliveries, grocers deliver, and to be home. So, and then Nikki Hamby says public health isn't a lifestyle choice, you walnut. So again, we're trying to deal with a serious situation. The name calling is, I'm sorry that you have to deal or hear that. Alternative Ego Bob Roberts would like to know the same thing. Why are assembled events being allowed, wearing no masks and so forth? And again, that's something you've really said, encourage everybody, wear masks, but more importantly, get vaccinated or stay home.
Yeah.
So one question here, we learn to live with the common cold and flu. The only way to get back to normalcy is do the same with this virus. Thoughts?
Right. So that's true. We have to live with COVID. We got to find a way to get through and take care of, from a medical perspective and a hospital services perspective, we got to take care of everybody with every medical condition, right, including COVID. When it comes to just in general in the typical population, just dealing with and living with COVID, it's a little bit different than the cold, though, right? I mean, you get the cold, you deal with it, and that's it. I mean, you get over it. COVID can kill. COVID does kill, and it keeps changing and evolving. Some strains become more contagious, some are more severe. And they end up they can end you up in the hospital, or they can end you up dead. So that's the major piece of that. That's why the vaccinations. That's why we have these calls. That's why we're doing all that we're doing here. So we have to take that seriously and find a way to manage around COVID and handling the folks that get sick and require admission and have severe illness and all of that. But we also need to be able to continue to live our lives, right? So how do you balance that? I'll leave that to the higher powers. I'm here to speak to the science and the clinical piece to it.
Vaccines were developed in record time. Why should we consider them being safe? Because that's a lot of things. Well, I don't want to be a risk, a chance. They've been dealt with in record time. What are your questions there?
That's a real valid question to ask, and try to get an understanding around that. It would seem that it's or appear that it's being rushed. This was rushed, in the right amount of studies and right amount of attention to it wasn't given its proper due, and therefore there's so much that we don't know. Well, in fact, what actually happened is that when they're running these trials out, the FDA runs 3 phases to these trials. There's 3-phase trials that are going on, and once you have to complete all those before it becomes to receive full approval, right? There are criteria to meet emergency use authorization, and then there's full approval. And the full approval is 3 phases, a 3-phase trial process. What they did was to run these trials in overlap. They were run simultaneously. While that was going on, when the vaccines got first developed and they're testing them, trialing them, they also simultaneously began to mass produce them. So you're overlapping your trials. They're all being done simultaneously. You are getting to the same endpoint that every other FDA trial for vaccinations has ever gone through. And you are getting to that appropriate same endpoint of safe for allocation, right? But then when you say you deem it to be safe and approved, well, now you got to start producing it. The process to mass produce on such a massive scale takes an incredible amount of time. They knew that ahead of time, so they started producing it ahead of completion of the trials, and they're stockpiling it. If they weren't going to pass the trial, they weren't going to release any of that. It'd be useless vaccine. They wouldn't have distributed that. But it was just all the steps that had to be done were being done simultaneously to get it rolled out as fast as they did.
So for somebody that's not vaccinated, we've heard the herd immunity. So some people believe that, hey, I've had COVID, so I have immunity. What thoughts medically on that, good, bad, and different?
Yeah, so the natural immunity to COVID is, you get sick, you get exposed, you're sick, you're infected with it. Either you have symptoms or you don't. There is some degree of immunity there. Some studies are suggesting that, some folks say with the longer duration of illness and severe symptoms, your immunity has responded in a more stronger fashion, and your antibody response is higher, so you're seemingly more resistant or more immune. When you couple that with the vaccinations, so again, some studies are suggesting that those who have been sick and subsequently vaccinated, those are the ones that are most highly immune or most effectively going to be able to prevent going through another serious illness if they were to contract it again. So just getting it, though, that really isn't enough. You absolutely can get it again. Folks who have been sick and vaccinated do end up testing positive for COVID again. But when you look at their symptoms, there's none or they're extremely minimal. So getting the full series of vaccination is extremely helpful, and get boosted, number one. For those who are sick, who have been sick or tested positive asymptomatic, definitely go through the full series of vaccination. It's going to help you more. Herd immunity is the concept that if I have 100% of a population and I vaccinate a certain percentage of that full population, we should create herd immunity, meaning that virus or whatever that contagion is just isn't going to have the ability to spread. It just can't jump from person to person if it's going to die itself out. That was the idea on, the goal to get 70% vaccination across the nation within a short period of time before the virus had time to mutate and change and become, and just keep kind of winning the war, so to speak. We didn't get to that 70% total population vaccination fast enough. We're still not there now. So COVID is still there. I mean, you saw it coming, and here it is. COVID hasn't gone away because we did not achieve true herd immunity.
So pregnant women, can they be vaccinated? I assume that's more of a question for their doctor, or thoughts on that?
Yeah, definitely. So in a general sense, yes. It is safe in pregnancy. American College of Obstetrics and Gynecology strongly recommends pregnant folks to get vaccinated. Severity of illness is increased. Risk of severe illness is increased when you're pregnant. So the strong recommendation is to get vaccinated. If you have personal questions or concerns, absolutely understood, and I do agree with you. I strongly recommend that you have that conversation with your obstetrician or your provider to get some direct feedback and make that correct decision for yourself.
How soon after being vaccinated is a person, in your mind, protected?
So you really want to go through the primary series. You are fully vaccinated after your first 2 shots of Pfizer, first 2 shots of Moderna, and the 1 of Janssen. After you've gotten that series, 2 weeks after, you're considered to be immune.
So let's go back. We haven't talked much symptoms that you're seeing. What are symptoms of COVID right now? The same as before?
Very similar to what it's always been. It's fevers, body aches, headache, shortness of breath, cough, some subset of sore throat. You'll see some of that. Children get can also get a GI situation with vomiting, diarrhea, some abdominal pain complaints. But the far majority of it is fevers, body aches, lethargy, cough, shortness of breath, headache. That's your classic. And despite the variants, whether it's Delta, this Omicron that's coming through soon, it's pretty much all the same. But if you have any concern or any wonder, is this COVID for me or not, call your doctor. We still have this same screening hotline that you can call to get you connected with the hospital system, and they'll go over a series of questions with you, ask you about your symptoms and exposures and this and that, and they'll let you know whether or not they believe that you're at high risk and you're likely could be infected. They'll line you up for testing, and if you need any kind of treatment, they'll do that. I can share that number again. It's 833-576-3627. Again, 833-576-3627. I'd also direct everybody to go to the website, the LaPorte County website. It's LaPorte County, LaPorte CO, all one word, .in.gov. That's a great site. It's got dashboard information on there. It's got all kinds of links. There's links to frequently asked questions, CDC information. There's a link there. Linked to state health departments, hospital links. Several different hospital links are right there. Strongly recommend. That's a great resource to go to get questions answered and get references to any services you may need.
And there's also, the state is providing a COVID test site at the depot on Washington Street, across from the jail. Walk in Tuesday through Saturday. I think the hours are at least 8 to 4. So take advantage of that. And then if people want to walk in and be vaccinated or boosted, they can do that at the old hospital, correct?
That's correct, yes.
And that was a quick process. In and out, it doesn't take long. Those are the symptoms there. So a question, have you had any cases, or is the county, tracking adverse reactions to the vaccine?
Tracking adverse reactions, right. So it's common to have, there's common symptoms you can get after getting the vaccine. Obviously, the most common one is some pain and soreness at the injection site. That's a reaction from the muscle cells there, and that's the muscle cells doing the job of starting to create that immune response. That is by far the most common. You can get low-grade fever. You can get a headache, feeling a little bit tired, but all that typically should resolve within 24 hours. If you start getting additional symptoms, persistent fever, persistent headache, cough, shortness of breath, that's above and beyond, and that should not be the case. That's more of a sign of actual active infection, and you should, again, seek medical treatment for that. Call that hotline, get in with your provider in whatever fashion you feel safe to do so, and get that checked out. Again, I'll say, regarding the vaccine cannot give you COVID. It doesn't have the ability to actually create the full COVID virus, which would then allow for replication of the virus. It actually creates a response by your immune system to start to develop antibodies.
So let's close up here. Doctor has been great for coming over. He's very busy. If you feel like you have symptoms, 833-576-3627. Call there. There is a walk-up clinic as well across from the county jail on Washington to have a COVID test, and then vaccinations available at the old hospital most every day.
That's right.
And we'd sure love to see that vaccination rate get up there closer. You see other counties is much higher than 45%.
Yeah, we could do a better job. I mean, hats off to those who are getting it done, and respect to those who feel that it's unsafe. But I would say for those who feel unsafe, talk to your provider. The more information you have, the more understanding you truly have around these vaccines and how they work and why they are safe, I think it really would help to persuade you to make a different decision.
Doctor, hopefully we can maybe check in with you in a couple weeks after the holiday, after Christmas. But thank you, and thanks to the staff. Again, number one, get vaccinated. Number two, during this time, you'd highly recommend wearing a mask, even if you're vaccinated. And for those that are unvaccinated, stay out of the public, stay out of big, large events. There are options for delivery of groceries, food, and other areas, but don't put yourself, and especially others that are at risk. If you have a family member going through cancer or some illness, you're putting them potentially at risk. So if you can't do it or don't do it, choose not to do it for yourself, do it for family members.
Yeah. Well said, yeah.
All right, well, we want to thank everybody for coming in and joining, and Merry Christmas to everybody. But Doc, thank you so much for your time.
Thank you.